Hi, my name is Jay Yu. I'm a student at the Medical College of Wisconsin, and today I am presenting my study on surgeons' preference in mesh selection and outcome in ventral hernia repair. For the background, currently there's low consensus on mesh selection in ventral hernia repair. The two major mesh types available are either bioabsorbable and the permanent type. The bioabsorbable types are believed to better promote tissue ingrowth and are resistant to infection, whereas the permanent type offers long-term reinforcement and durability. And the purpose of the study, we want to correlate mesh selection and the type of procedure, as well as the risk and rate of complication defined as surgical site infection, SSI, surgical site occurrence requiring procedural intervention, SSOPI, as well as readmission. And for our method, we have 180 patients retrospectively reviewed who underwent ventral hernia repair at the Freighter Hospital and the Medical College of Wisconsin. Their data were collected and using the Oracle tool available on the AHSQC website, we calculated their complication rates. And just looking at the results here, we can see here on this top figure that bioabsorbable mesh was used more frequently in patients with higher risk of complications across the board, whereas looking at the true rates of complication, we see that bioabsorbable mesh has a higher rate of remission. And moving forward, we also see that the bioabsorbable mesh was used more frequently in open procedure compared to laparoscopic procedures. And in conclusion, in clean wound ventral hernia repair, the bioabsorbable mesh was selected more frequently for patients with a higher risk of complications and for open procedures. For both mesh types, they both have a very low true 30 days rate of SSI and SSOPI, but a higher 30-day readmission rate was observed in in patients with bioabsorbable mesh. And again, here's my contact information. Please let me know if you have any questions. Thank you so much again for your attention.